Hemochromatosis is defined as 45% and up to be that you have iron overload. So, because one thing we need to tell, iron is the only element in the body that the body cannot dispose of it. Whatever iron you take in, the only way that your body gets rid of it is by bleeding. We have control over our lifestyle. So the better our lifestyle, the better it is.
The fast loaders get the heart rhythm problems and the liver issues because the iron's just being moved straight into the organs there.
Just to clarify for people watching now, ferritin is considered the storage iron, and then there's also, we talked about the serum iron. So how do those two differ that you found? And then there's also the other factors we talked about.
Well, ferritin is the storage, and in normal circumstances, it's totally safe. A lot of people don't realise that. It's the serum iron which is causing the problem. That causes the oxidative stress. In general, it actually reacts with hydrogen peroxide, which is naturally in us. There's very small amounts, but that produces free radicals, and then that damages all the cells as it comes across immediately.
So which level, where would it fall, just talk with the UK scale, the serum iron that one would be worried about? Is it just within the range, or we're talking much higher above the top end of the normal range?
Yeah, I mean, it's funny. I think anything over 200 now. I think you were mentioning English numbers. And sort of more au fait with the US numbers. But anything over 200 is high.
Okay.
It's basically out of range. So that's probably the way to put it. And what we generally look at is transferrin saturation. Because that's the serum iron divided by something else called TIBC.
Right.
But it's generally moved by the free iron, this iron, and that's what's causing the damage. And it also makes people tired. It causes joint pain, and it's often the slower loaders that occurs in, not the fast loaders. The fast loaders get the heart rhythm problems and the liver issues because the iron's just being moved straight into the organs there.
These are the drip feed.
Yes.
Okay.
The problem with total iron is very dependent on your diet. So that's why it has to be a fasting. If you're a carnivore, or you had a steak the day before your blood, so you will see a higher total iron. Or high. So I measure. So what we recommend to measure is a total iron, TIBC, ferritin, transferrin saturation. You'll see a lot of variation on patients based on what they ate on the total iron, their transferrin saturation. So transferrin saturation, for example, in the US at Quest Labs, up to 55% is normal. Hemochromatosis is defined as 45% and up to be that you have iron overload. So there's 10 points where you're like, what do I do with those patients? So you need to follow it over time. The ferritin is not as influenced by your diet. So that's why it's an easy one to follow. But for example, we'll see patients who donate blood and then they check a ferritin within the first 6 to 8 weeks and they have a low ferritin level because it takes time for the ferritin to build back up. So really, when you're looking at, I think you went through de-ironing, right, to vivisection, and they monitor ferritin. So when you start with a ferritin at 1400, like Robin started, usually they'll have you donate blood every week to 2 weeks until your ferritin really goes down. Then your maintenance, usually maybe a few times a year. Are you on a maintenance regimen now?
Yeah, 3 to 4 months.
3 to 4 months.
And what's your ferritin level now?
Well, it's normally between 75 and 50. Okay. So we try and get to 50. But last time it was 150 and my transferrin saturation went up high. And that was, I think, because I just had COVID.
Okay.
I was in America actually, and I caught COVID probably on the plane.
So it is not an easy subject. It is not something we know everything about because, as we said, it's 25 years only that we understand ferrotoxics. There's even another term called ferroptosis. You've heard about apoptosis. right? This is when programmed cell death that happens. There's ferroptosis. When your iron level is up, it increases the level of cell death. And we know that when cells die, they release a lot of cytokines that increase more. That's why autophagy is something important in our world. So we're starting to understand the world of ferrotoxic disease, ferroptosis compared to apoptosis. So all those terms, I've only learned about this about a year ago. But my quest and my fight with this is we need more people to look into this. We need more lectures. We need more education and more research on ferrotoxic disease. The last lecture I listened to was Dr. David Sinclair, who did a really good presentation on iron overload. And since then, it's been crickets. So again, and especially you being in the UK, I'm going to give an example. My wife has Irish blood, Irish descent, and she is heterozygous for C282I, which is the gene for hemochromatosis 1. When she was premenopause, she had pretty heavy periods. She was iron deficient. So she had to take iron all the time. When she became menopause, she developed iron overload. So her ferritin level for women, it's on a lower range, went into the 200 to 250 range. And it's not that, again, she felt bad with it because the levels didn't go too high. But if we didn't do anything about this and we let her continue to accumulate iron, she would get into the 500 or 1,000, I don't know what level, and that will have an effect on her longevity. So, because one thing we need to tell, iron is the only element in the body that the body cannot dispose of it. Whatever iron you take in, the only way that your body gets rid of it is by bleeding. So iron, you take it, so it's almost like it's compound interest, right? You keep depositing, and there's no ways to withdraw it. Women tend to be protected, and when you look at, there was a really good paper that talked about the iron hypothesis of heart disease, that it says that really that there's a lot of studies showing that high iron is really part of why you get heart disease. When you think about LDL, it's not the LDL that's the problem, the bad cholesterol, it's the oxidized LDL. And what is oxidized? Oxidized is iron. You talked about the Fenton reaction. When iron combines with hydrogen peroxide, and it causes OH minus, which is hydroxy radicals, that does get and denatures protein. It affects lipid membrane, it affects DNA, it affects so many things. So yes, we have to measure those. We have to account for this.
That's interesting because sometimes they'll say with heart disease that men are at higher risk than women up until after menopause for women, and then I think it evens out that women catch up to that, and maybe it's that.
So one hypothesis was that it was the hormones that after menopause women lose their estrogen, and that's what causes the high risk of heart disease. But there's a hypothesis that is very, very strong, saying that it's because women after 3 to 5 years of menopause, they have the same levels of iron as men and the same level of heart disease. So that's very interesting.
Yeah, that is interesting,
right? When we think about this.
So a lot we still don't know, and trying to piece together, and it's really hard for, especially advocates of longevity medicine, or we talk about health span medicine, because really my focus would be to have a longer health span rather than. Even though my genetic profile doesn't look so good for that one, but I'm doing everything I can despite the report.
And the more data you can have. For example, you were talking your genetics. If there's something that you see that, okay, I may be predisposed to have heart disease or to have aneurysm, you're going to take more attention to your blood pressure. You're going to take more attention to your overall visceral fat, to your overall weight, because those things affect your genes. So what did they say again? The genetics load the gun, but lifestyle factors of the environment pull the trigger. So we have control. We don't have control over our genetics. We have control over our lifestyle. So the better our lifestyle, the better it is. And you know what? If I know that I have a tendency to accumulate iron, I will adjust my lifestyle so that this doesn't happen to me.
Maybe donating blood.
You can adjust if you're a slow loader. So, but fast loaders, you have to have blood donation.
Okay.
But there's a way to mitigate.
And which tests tell you if you're a fast loader or a slow loader?
Well, check iron will tell you. It will tell you which you are.
And I have to tell you, I have my patients upload their data on check iron because there's nowhere else that I found that is able to help you with that, how fast you're going to develop disease. And my hope is that with Robin on checkiron.com, more people can go and use it, because you have what, 2,500 data. I'd like
we
for it
want
to get
more
to
because we
5,000
use AI to actually interpret the data, and we just need lots and lots of data. That's what AI needs. Something like we use 300 mutations at the moment, and that's basically, I've limited that. I could make it a lot more, but 300 would correspond to having 3,000 people with telling us what age they got sick, and not everyone tells us that.
And there's no cost to send it to you?
No, it's free and anonymous. I bear the cost. It's my own charity, effectively.
But very important, anonymous, because a lot of people don't want to get their genetic data to be uploaded anywhere. It is anonymous.
And we will never sell the data. It will never be given to anyone else or anything.
That's global. You take the data from anyone.
Yes, a lot of it comes from America. And a lot from women, actually. Surprisingly, women are more aware of their health than men.
Yes. We're trying to change that. Let me say a few more things.
That's always the case, right? Men would never go to doctors.
It's not broken. Yeah, we don't want to. Let's talk about a few more interesting things about iron overload. They found out that the musician Beethoven had a compound heterozygous. So he had both C282Y and H63D. He died of liver disease. Of course, he drank alcohol. He was deaf also. So a lot of this can be associated with this iron deposit. Hemingway, the author, was found to have hemochromatosis. He was a heavy drinker, but that could have been why also he developed cirrhosis. There's Courtney Cox is a big person that's on Hemochromatosis Foundation, because she found out she had hemochromatosis. There's a royal family member in Scotland who died at the age of 59 of liver complications, and they found out 1 year before death that she had the genes for hemochromatosis. So there is even a charity trying to screen everybody of Scottish origin, because the incidence is so high. So my point is always, we know that this is there. Well, we don't know. We're trying to raise awareness that iron is important. There's an easy way to screen. Why wouldn't we do it?
Yeah, and it's not too difficult to fix potentially if you have.
Well, it's so easy, just giving blood.
So my approach to high iron is, because again, you have the oxidant side and you have the antioxidant. So the key to anti-aging to have a better balance.
Right.
So I decrease the oxidant side by managing my iron, decreasing all kinds of, like all toxins and everything that you can. And I increase the antioxidant side. Things like quercetin, really, really important to help decrease iron and decrease the oxidation potential of iron. Selenium is very important. Vitamin A, the ceruloplasmin, it's something that's really important. So getting adequate amounts of copper, it's really important to help you manage your iron level. So when I see somebody with high iron, I help blood donation, low iron diet, and increase your antioxidants. That's usually a three-pronged approach that I have for my patients with high iron.
Anything else, Robin, that you want to add to the?
I mean, the other one, you mentioned ceruloplasmin.
Yeah.
It's common for people on Facebook to actually complain they have low ferritin and high saturation. This can be for lots of different reasons, but one of which is deficiency in ceruloplasmin. And what I find half of those people are taking daily zinc, and they take zinc to help the immune system.
That depletes copper as well.
Zinc actually blocks copper absorption, so eventually it actually means you can't convert free iron to ferritin, and this free iron is the one that actually causes all the problems.
Maybe I need to lower my zinc status. Now, some of our patients who are trying to manage their estradiol using zinc citrate manage, I suppose. It needs to be in balance with a bit of copper as well.
Yeah, you can get pills with both zinc and copper in, and that's probably the best way, because you're getting the dose right, because there's a danger of too much copper.
And that's the problem with vitamins and supplements, that you can overdo one over the other. I mean, even to the point of the antioxidant theory was that, how are we are we using too many antioxidants and driving it the other pathway? I think we were talking about that with NADH. And then are we doing too much with NAD, and which pathway does it go down? And we have no way to really measure that either.
And another thing I want to say, some people may see, they say, okay, I did my genetics, I have no SNPs, no abnormal genes for my iron, that doesn't concern me. Actually, no. Iron overload will happen to everybody. Because as I was saying, the body has no physiological way to excrete iron once absorbed. Yeah. And both in the UK and the US, there's the iron fortification program where they added iron, filings of iron, inorganic iron into all of our flour, the cereal, any carbs has iron in it. And when you think about it, the RDA in the US for iron, the recommended dietary intake, it's only 8 milligrams a day. 8 milligrams a day. And you think about it, most cereals have about 12 milligrams per cup of iron. Most protein bars, about 12 to 18 milligrams per cup. Serum or most multivitamins will have iron, 18 milligrams of iron. So just with this, a lot of our patients, like in the anti-aging world, they're either carnivore, eating a lot of red meat, which I'm all for. But what if you accumulate iron? What if you have too much iron? You have to monitor your levels of ferritin and be able to balance that. Dr. Salandino, who's the big carnivore diet, I was watching one of his YouTube channels and he put his labs up and he showed that his ferritin was in the 400 range. And he actually, it's somebody that was listening and said, Doc, you may want to check your iron level. And he started doing venesection on YouTube and giving it to his friends. We're not going to be that. But anybody checking too much iron, it's not just people who have the gene for hemochromatosis.
So
everybody. It can affect everyone.
Well, you mentioned the iron in cereals, like Kellogg's cornflakes or something. The thing about that iron is it's pure iron. The reason why they did that was because initially they put, say, iron sulfate in or something, but that absorbs too quickly. So the way around it, they thought, oh, we'll just put pure iron in because it has to react with stomach acid and then it will go through the stomach. But and this was done in 1940, before you've ever heard of leaky gut. Because if you've got both leaky gut and you eat these cereals, the iron will go straight through the gut into the bloodstream as iron, and then it is totally destructive. Yeah, it will kill.
Poisoning, really.
It is poison, and Denmark stopped it in 2004. Stopped adding iron to cereals, but
not in the UK.
The UK and the US, they add ordinary iron to cereals and to flour that's used in baking bread. In most bread, I think wholemeal it doesn't have it, but
organic flour doesn't have the iron.
Well, I think by law it's mandatory; they have to. French bread, in France they don't add iron. So French bread is okay. You can buy real French bread.
Yeah, real French bread. But the UK and the US continue with their iron fortification program. And when you look at it, they started the iron fortification program to help combat iron deficiency anemia. And here we're talking about the bad sides of iron excess. There's no question that iron deficiency remains a big problem. And we do have that for women of childbearing age, women who have heavy period. That is a problem. But if a woman has iron deficiency anemia, I'm not going to tell her eat more cereals. I'm going to have her take either iron supplement or liver,
Yeah, I mean, it should be prescribed.
Yeah.
But imagine kids, little babies eating cereal because they like it.
Yeah.
And oh, mummy, can I have another bowl, please?
It's quite Moorish.
Yeah.
I mean, it's good. You have one bowl, you want to.
So they get double the dose.
Yeah.
And it's also
when I was young, I'd have 2 or 3 bowls of cereal at one sitting.
Imagine the amount of iron that you take.
So it's very dangerous.
Yeah.
Very.
I've got 2 bone spurs in my shoulders that develop, ironically, and it's tied to osteoarthritis. But I always wondered, in the past I had much higher ferritin levels than now. So.
Who knows? So my point is always, everybody should know their iron status. And if it's elevated, you should know, your genetic status on this. And if you see that your levels based the functional medicine range of ferritin, and that's the easiest one to follow, it's between 50 to 75 or 80. If you're anywhere outside of this, you should find a way to manage your iron, because it has long-term consequences that our vision of health span medicine, lifestyle medicine, that goes with it.
Yeah, absolutely. And then if everyone in the UK, if you want to do your genetic tests and send them over to check iron, that's one way to do it. And if you're a Balance My Hormones patient, you know, and you're coming through, or even if you just want to buy a blood test from our website, balancemyhormones.co.uk, in the UK, we have the full panels that check the iron, ferritin, TIBC, the whole iron studies are included in that. So it's really good to know. So,
very good.
Thank you guys. Thank you, Robin. Thanks, Rudy. And also don't forget to check out, Rudy, what's the website?
So we have the Medical Health Institute, www.medicalhealthinstitute.com, and my personal social media, Dr. Rudy Best Life, where I try to put out a lot of content and educate people, raise awareness.
Amazing. Anyone out there that's watched and have their own stories to talk about, you know, iron overload, ferritin, hemochromatosis, let us know in the comments what your experiences have been, and we'll be sure to try to answer them. And until next time, remember, stay healthy, be safe, and we'll see you next time.
If you found this video helpful, don't forget to watch our other videos on topics around HRT and TRT, and don't forget to subscribe to the channel. And until next time, stay in good health. This is Mike from Balance My Hormones.